Time now for the Spine Doc, putting you on the road to better spine health, featuring Dr. Pasquale Montesano, MD, world-renowned orthopedic surgeon and spine and joint treatment specialist at Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, and Naples. Dr. Montesano is a pioneer in the development and application of the revolutionary A2M treatment for lasting proven relief of chronic pain and discomfort in joints. Now, here's your host, Brian Content.
This is the road to better spine and orthopedic health with the Spine Doc, Dr. Pasquale Montesano, MD, of Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, Naples, and San Juan Capistrano, California. And good afternoon once again. Dr. Montesano, how you doing?
I'm doing great today, Brian.
That's good.
Thanks for having me.
You know, your practice deals with diseases and disorders of the spine, scoliosis and other deformities, cervical thoracic, easy for me to say, and lumbar trauma, and kyphoplastic surgical treatments. And you are a highly trained orthopedic surgeon who also, in addition to having to deal with major trauma cases involving the spine, your practice also deals with other aspects of orthopedic injuries, deformities, maladies, and so forth. Explain a little bit about what you do in your general practice.
Well, Brian, we see everything from the slightest complaint of minor backache to more major complaints of herniated discs, broken vertebra, scoliosis, deformity, infections of the spine, and in some cases, cancer of the spine. So there's really not any aspect of spinal care that we don't address. Our treatments include as minimally invasive as you can be, which would be to insert needles and inject different therapies, and obviously the most highly sought-after therapy now, which is alpha-2 macroglobulin injections. It's harvested from the patient's own blood. And once again, it's to be distinguished from other treatments that sound similar. And our treatments include standard discectomies, designing conservative treatment plans, non-operative plans, exercise programs, physical therapy programs. Our practice includes reconstructing the spine with fusions, with disc replacements, all when the appropriate situation arises. And then the more complicated revision surgeries, when somebody's been previously operated and the operation has failed, it hasn't healed, or it healed, but it healed in a deformed position. It needs to have a revision. Sometimes that revision will have to include very technically precise and difficult procedures such as osteotomies, and there are a number of different types of osteotomies that we do in our practice that are extremely difficult. They're higher risk, of course, but they're very rewarding to the patient when appropriate.
Now, you are a highly trained surgeon, having had a background coming from New York and receiving your medical school training at Siena College, New York Medical College. You've attained a variety of certifications and awards, including the Volvo Award in clinical science, and also receiving the How Medica Spinal Fixator Grant, which is not something that comes easily to many doctors in your profession.
You know, that was years ago. That was one of the first studies on pedicle screw fixation. And so we've been there from the start. I was probably the first person west of Mississippi to ever put screws in the upper cervical spine and lower cervical spine as well, having trained in those procedures in Europe by the guy who originated them, Professor Fritz Magrel. And then coming back to the United States, I ran the adult spine program at the University of California, Davis for a number of years, and then had a complex spine practice in Northern California, and then relocated to Florida about 6 or 7 years ago.
We are certainly glad that you are in this area. You know, there are a lot of doctors. South Florida is, there's a lot of older folks, a lot of doctors that come to this area because there's money in South Florida, and people think that they may be able to get some of the best treatment available, and certainly with you, that is. But there are a lot of doctors out there whose treatment methods, whose outcomes are just not quite up to snuff, and sometimes you're called upon maybe to make things better?
That's correct, Brian. I think every doctor tries his best or her best to remedy a particular situation, but sometimes the primary surgery fails, and a patient really needs to do their homework, ask the appropriate questions, and find out who's doing the difficult stuff, who's doing the osteotomies. Because if you're capable of doing osteotomies, which probably only 3 or 4 surgeons in South Florida are really capable of doing, then the other stuff is easy to do. And they should see if the surgeon is a member of. There's some societies that are very selective to get into. You have to be internationally known, such as the Cervical Spine Research Society or the Scoliosis Research Society. So determine whether your physician, your surgeon, has achieved membership into those societies before taking the next step.
So your credentials back up everything you're saying about being one of the top spine docs, orthopedic surgeons in South Florida right now, since you've relocated here, and dating back for so many years, your credentials are impeccable. You also are not so quick to look at somebody and say, hey, surgery is your option here. We got to go with surgery. You take a bottom-up approach.
Brian, when I was in California, we developed a wellness center there. But it's a large, I know a lot of people use that name in their practice, but our facility is about 40,000 square feet. It includes on-site chiropractic, physical therapy, massage therapy, orthopedic surgeons, there's podiatrists on site, there's estheticians on site. So it's a total wellness kind of approach. There's a large fitness center. We've been awarded number 1 wellness center in the United States by the American College of Sports Medicine. We have a large variety of techno equipment. If you're familiar with the equipment that are at different fitness centers, techno is probably the top of the line equipment. It comes from Italy. Very expensive, I might add, but it's really worth the investment. And we have a number of world-class athletes that train at our facility. So our first step always is designing a non-operative treatment plan. I like to use aquatic therapy. When the patient can swim, I put them in a swimming program. I always start out with the side stroke, because in an overhand stroke, you have to hyperextend your lower back and your neck too much. If they can't swim, then it's simply a walking program in water. Usually I try to have them do such a program for a matter of weeks. But many times a patient comes to me having already done a conservative program, so I don't think that there's really a need to repeat that step in all situations.
You approach treating an injured spine or a degenerative spine as compared to general back pain symptoms, which may not be able to be clinically diagnosed. So when someone comes to you and they say, they've got a problem, whether it be a knee joint, a shoulder, elbow, or just back pain, how do you go about trying to hone in on what the problem really centers on?
Brian, most people are concerned with getting better, getting their treatment started, but my main concern first off is establishing a diagnosis. A very, very small percentage of patients that may present because they have an underlying tumor, and we need to find that out first. So the thought process is always there. And in the older group, those tumors usually are the type of tumors that come from another site. So the tumor that's located in the spine is called a metastasis. But there are other tumors that can primarily start in the spine as well in an older population, like multiple myeloma, lymphoma, these types of things. The tumors that metastasize to the spine, we have a little mnemonic: bacon, lettuce, tomato, and a kosher pickle, breast, lung, thyroid, prostate, kidney. So we look at a workup that includes at least thinking about those locations. And then if the spine has been broken, has been injured in such a way that it's unstable, we need to know about that, because it could be that it's so unstable that it precludes starting some type of an exercise program. But once they've gone through that primary and secondary screening, then we can initiate the treatment at that point in time. And it's important to get an initial screening done before you start any type of conservative treatment. You've got to take a look at anomalies that can occur with the spine, all the outliers that may lead to a problem if you start your conservative program without at least doing a little bit of a survey.
You're listening to Dr. Pasquale Montesano of Montesano Spine and Sport, one of the most renowned spine and orthopedic surgeons in South Florida, with offices in Palm Beach Gardens, Naples, San Juan Capistrano, and I understand soon to be in Las Vegas. And if you want to find out more about Dr. Montesano, don't just listen to us talk, but go to his website and find out the bona fides there, spinedocs.org. Check out Dr. Montesano's background, his treatment methods. Read for yourself and then compare. And you'll find that Dr. Montesano is indeed one of the top people that you could choose to go for treatment. Now, you can also call the office. The number is 866-79-DR-SPINE. Set up a consultation visit. Dr. Montesano will be there to assist you in getting you on a treatment program and finding out what's wrong and what's the best approach. Certainly a consultation, very important to get you on the right track. Now, sometimes, though, you find situations being a trauma surgeon or things that have to do with the spine are quite a bit different than just joint treatment or treatment of arthritis and things like that, which are also part of the orthopedic practice.
Correct, Brian. I mean, normally when somebody comes in because they have a herniated disc, or they come in because they've got spinal stenosis or something of that nature, we're not worried about the spine having lost its ability to protect the neurologic structures. It's when somebody's been involved in a trauma that we have to evaluate things a little bit further. And there are many tricky situations, many processes that the initial screening series of x-rays and MRIs may be normal, and so you have to do follow-up studies in some situations. And sometimes you don't see anything in certain diagnoses when somebody's been in a trauma like ankylosing spondylitis, and you really should admit those patients to follow them overnight, because sometimes the fractures aren't that obvious, and they can be highly unstable fractures, and you really don't see them on x-rays initially. But within a few hours, sometimes the fracture line will become visible.
Now, sometimes you get patients coming into you who have not found the satisfaction after being treated by other orthopedic surgeons and spine surgeons. They come to you because there's something happened with that doctor, with that treatment that may start off well, and then all of a sudden it's not so good anymore. And then you get a phone call, and then you have to do what is called a revision, as you explain. What is that about?
Revision surgery, Brian, simply means that the patient has been operated on previously. It could be that the operation never healed. This is called a pseudarthrosis. Pseudo meaning false, arthrosis joint. So you've got an area where it didn't completely fuse. It could be that you didn't do a fusion first time around. Maybe you just did a discectomy, and now there's a recurrent discectomy. Those are more of the easier types of revisions to do, especially that second one where you just have to go in and take the herniated disc out again. That's probably the simplest of revisions. The hardest revision is when it may have healed partially, but it healed in a collapsed or deformed position, and now you have to break the spine. This is called an osteotomy, and you have to realign the spine in another position, a more anatomical position. These are probably the hardest of the revision cases.
Unfortunately, as you've mentioned, there are doctors who are really not qualified in the sense that you are, a top-notch spine surgeon, who are performing these types of procedures initially and not getting a good outcome. And this is when sometimes you get patients coming into your office looking for a better outcome.
That's correct, Brian. And I don't want to cast a negative shadow. as much as I don't expect that every spine surgeon out there is trained in osteotomies, the Ponte osteotomy, the pedicle subtraction osteotomy, the 3-column osteotomy. These are procedures that only a select minority, maybe less than 10%, less than 5% probably of the spine surgeons out there. But, if you find somebody like that, that type of an individual is going to find the straightforward cases that much easier to do. And it's that type of surgeon that's necessary to revise a case when the surgery has failed.
We do have a patient of yours, Sherelle, who's joining us now to talk a little bit about a revision procedure that you did. And let's bring her on right now.
Sherelle, how are you doing this afternoon?
I'm doing good.
So let me take you back, and without mentioning any names, because our job's not to criticize somebody else, but you had back pain for a while, and then neck pain for a while, and then about 5 years ago, you underwent a multi-level neck operation. Is that correct?
Yes, correct.
And how long had you had pain prior to that operation being done?
Oh, I had pain for a long time. I would say the past at least 5 years
So you had,
before that, yeah.
You had pain for about 5 years before that. Then you had a surgery. How did you get referred to your surgeon?
Well, my primary doctor had sent me for an MRI, and then after he saw my MRI, he sent me to a pain management doctor. And when she saw the MRI, she didn't want to touch me, so then she sent me to this doctor that did necks and stuff.
Right, great. And then, so then he prepared you. He gave you a diagnosis. He, obviously he took a thorough history from you, did a physical examination, went over your studies with you, and then you guys headed off to surgery. Now,
right.
How long did the surgery take, and how many days did you stay in the hospital overnight? Were you discharged as an outpatient?
I was an outpatient, but I was in the operating thing. My husband said at least 4.5 hours.
Okay. And then tell us how it went after that.
I was in like a different kind of pain after that and stuff like that. But then as time went on, I started having really bad pain on my left side. And every time I would move my head to the left, it would just go right down to my arm, into my face, and it wasn't getting, as time went by, it wasn't getting any better, and it was getting worse. I started losing kind of feeling in my hand, and I was like, oh my God, so I kept going back, and, I kept getting, we'll do injections, we'll do this, and it wasn't helping the problem. So I just got to the point where I got tired of it, and then I said, I need to find another doctor, and then I found you.
But that wasn't really a short process. That was about a 5-year journey from the point in time when you had that surgery.
Right.
So you were miserable for about 5 years, and
oh yeah,
people were telling you that there was nothing they could do for you other than give you injections.
Right. They kept giving me trying to give me these injections, and then a couple times I went for it. They couldn't even get the injection where they need to get to make it, feel better. And one time that I went in, they even singed one of my nerves so that I would lose the, the sensation of the pain, I guess, and stuff like that. But it was right after that, I still had the, pain.
Sherelle had a fusion done in her neck. It really wasn't done in a standard fashion. It was done a little bit unconventionally. By that I mean it wasn't done in the way that the majority of surgeons would have done it, and it ended up not healing. And so it's hard. Here's a woman that comes into me 5 years later, and I look at the X-rays and I can immediately see that it's not healed. So there's a lot of psychology involved because the patient's miserable, and this is kind of what happens all of the time. And how do they know to trust me? Because I've made the diagnosis so fast And why didn't the other doctors see this? And, why did she have to be in pain for these 5 years, et cetera, et cetera? And I don't really have good answers, Brian, for a lot of that, but usually when there's a pseudarthrosis, when there's a deformity, it's obvious. It's not like it takes, in good hands, the guy who makes the diagnosis is not going to take a long time to make that diagnosis. It's going to be pretty obvious. So we told her that basically, very simply, she had not healed and she needed to have her neck surgery revised, and there was just no way around it. And to give her injections or to do anything other than that really wasn't going to address what the main issue was.
Now, Sherelle, I imagine hearing that another surgery must not have been too exciting for you.
Yeah, I was not looking forward to that. I mean, I was scared because, I was kind of hoping that, I could get it fixed thing. But then, I felt comfortable talking with him. He went over everything with me, and explained everything that was going on. He had my MRI and all my other stuff, and he put it on the screen to where it was like a 3D so he could show me all the problems and what was causing, so much pain on my left side and everything. And I said, well, I'm going to put myself in his hands, and he knows what he's doing, so I'm going to let him do it. And see, and now it's like I can actually lift my left arm without getting that, sensation, and I haven't had any, sleepiness in my hand anymore, or, and then when I turn left, I'm still in the healing process because it'll be 10 weeks that I've had it done. But when I turn my head at least a little left, I don't get that pain shooting down in my arm anymore, and my face isn't numb. So to me, that is a plus right there.
The other thing, Brian, that's important is the patient's support system. And I have to tell you that Sherelle has a great family. Her mother's great. Her husband's great. And it's really important to have all of those aspects lined up. I address each situation the same, every patient the same. I have the same format, the same questionnaire that they have to answer that they all hate to answer, but it's very inclusive and comprehensive. And, some patients, I'll take the same amount of time with every patient, and some patients, at the end of it, they'll tell somebody, well, he hardly spent any time with me. Other patients will be like, sure, and they'll say, well, he was very complete. And as a doctor, I do the same thing each time. So it's really perception. And patients that are in miserable agony and pain, you have to win them over, because a lot of times they've been told things that didn't pan out to be the truth by other people. And, now it's harder the second time around. The first time around, you don't have to win the patient's confidence. They're coming to a doctor. In America, people still think the doctor is, a very important individual, trustworthy, honest, and they listen to him. But the second time around, the third, fourth, fifth, sixth, then, the patient, you have to kind of be in their shoes for a little bit, and why should they really trust you? Because things didn't work out the way other people told them. So you really have to win their confidence, Brian.
Well, it seems like you did that with Sherelle's case, and now she seems on the road to recovery. Have you had a chance to re-look at your work after this 10-week period, and how's it look to you?
Brian, we had to do the osteotomies that we were talking about. We had to do a fusion multi-level with screws and rods, and it was a big undertaking, but she flew right through it. It was amazing. The next day she was doing so well, and I can't say enough good things for the patients having a positive attitude like she has. And she's just done marvelous, and the follow-up x-rays have all looked great.
What about now with the rehab exercise and such that go along with that, or is it kind of you got to lay low for a while?
Mainly it's the same thing, low-impact aerobics, walking and things like that. And then soon we'll put her on a neck muscle strengthening program.
Well, thank you so much, Sherelle, for coming on and sharing your story. We appreciate it, and we wish you the best of success in your road to better spine health. Well, Dr. Montesano, that was quite a testimonial, one of several that we've had since we started doing the show, because you are producing the results that people can be confident about putting themselves into your hands because of your great expertise. You are one of the top spinal surgeons, orthopedic surgeons in the country, world-renowned, and certainly your manner and your treatment methods are providing great results.
You know, Brian, not everybody is going to have the same view of me, obviously, and you can't make everybody happy. But, you know, I always tell my patients that at the end of the day, my job is to look at what's going to happen when I leave this world and I go before the Lord. And he's going to have that G-pad. I mean, we use the iPad. He's going to have the G-pad. It's going to have every patient on it. And he's going to want to know if I did the right thing. Not that I make him happy, not that I do what they wanted, not that I give him, you know, the drugs that they want him to do, but that I do the right thing, that I push him to get in shape, that I push him to be part of the solution. Because you're either part of the solution or part of the problem in everything in life, Brian, not just health. And you've got to, each patient has to, you know, take the responsibility like this patient did all the right things, and then she's really a setup for success.
You've been listening to Dr. Pasquale Montesano, MD, of Montesano Spine and Sport, with offices in Palm Beach Gardens, Naples, San Juan Capistrano, Miami, I should mention, of course, we are in South Florida, and specializing in diseases and disorders of the spine, scoliosis and other deformities, cervical, thoracic, and lumbar traumas, and kyphoplasty surgical treatment, as well as injections with the A2M method, which is alpha-2 macroglobulin, which is a new type of procedure which is becoming more widely accepted here in the United States, which is backed by science, unlike some of the treatments, the injections that you can choose to have, which do not bear out when you take a look at them very closely. They just do not have the science proving that they do provide results. So keep that in mind, because whether it's a trauma to your back, whether it's a degenerative situation for your spine, whether you just have pain, nagging pain in your joints, Dr. Montesano may have the prescription for you. So give him a call at 866-79-DR-SPINE, 866-79-DR-SPINE. Make an appointment, get a second opinion, or just come to him because you have confidence now after hearing us today or any one of the number of shows we've done so far. And better yet, just visit his website, SpineDocs.org, SpineDocs.org. Find out everything you need to know about Dr. Montesano's background, about his treatment methods, about the practice, and helping you to get a comfort level in choosing to contact Dr. Montesano. We will be back again next week at this same time on the road to better spine and joint health with the Spine Doc, Dr. Pasquale Montesano, MD.
You've been listening to The Spine Doc with world-renowned orthopedic surgeon Dr. Pasquale Montesano, MD. For more information, visit us on the web at spinedocs.org. That's SpineDocs.org. Or to make an appointment, call 866-79-DR-SPINE. Join us again next week for The Spine Doc, putting you on the road to better spine, road to better spine, road to better spine, road to better